Art therapy, as I explained earlier, is a tool that harnesses the power of art with typical therapy sessions. This creates a form of creative expression that cannot be reached through therapy alone. An art therapist tailors your session to you personally, using your issues and struggles to create projects that are ideal in your personal growth. Quoted from the Georgia Art Therapy Association, art therapy can facilitate change and provide coping skills, often with much more clarity than words alone could have provided. Art therapy, facilitated by a professional art therapist, effectively supports personal and relational treatment goals as well as community concerns. Art therapy is used to improve cognitive and sensory motor functions, foster self esteem and self awareness, cultivate emotional resilience, promote insight, enhance social skills, reduce and resolve conflicts and distress, and advance societal and ecological change, as quoted by the American Art Therapy Association. Art therapy can be used as a one on one session, couple sessions, family and community sessions to confront issues, cope, and heal. The pieces made by those in art therapy are not only used as conference pieces, which is just talking about your issues, but also as diagnosis pieces, which are those that can lead to a direct diagnosis of your issues. Now that you know how art therapy works, let's discuss who is eligible to see an art therapist. The short answer is anyone. Anyone can see an art therapist to talk about and express any issues that they have. The long answer, however, is more extensive. Therapy is not just for those who are mentally ill. Therapy is for anyone who would like to talk about any stressors in their lives and issues that they would like to vent about. Therapists are vessels that take the material that you tell them and transpose that into a helpful message or even medication that will ease possible ailments that you might have. Art therapy is for the sound of mind as well as the frail of mind and or body. People with autism, Asperger's, PTSD, anxiety, depression, Parkinson's, the stuff that I had said in my introduction, are eligible to see an art therapist. Children who have experienced trauma in a domestic setting or the elderly who have long since forgotten their past and loved ones are more than eligible for art therapy. Anyone who wishes to express the issues that they are facing in a relaxing and colorful environment can participate in art therapy. So let's talk about how art can express what a person is thinking and how that affects the brain. So expanding off the main definition of art therapy, which is using art to heal. How does an art therapist gauge what is and isn't normal in a drawing? It's perspective, isn't it? What is a telltale sign of an issue in art? What's considered expression and what's considered bizarre? Those are the hard questions when talking about the legitimacy of art therapy. How do they know? Well, there are theories in the use of line quality, color, tonal quality, use of shape and space. Now, to a person who isn't literate in art talk, this is a bunch of nonsense gibberish. So, I'll give a few examples. An art piece that has harsh, thick, jagged lines were probably made in anger. Thin, light lines made in non-saturated shades like grays and blues probably indicate sadness. Bright colors are happiness, yellows, oranges, bright, wow. Shapes that are round and bubbly mean lightheartedness, you're happy, you're joyful. Boxes or rectangles can mean solitude, solidarity, you're stuck. A piece that is cluttered and busy with all these scribbles and colors or stress, and a single small drawing in the center of a big picture can express loneliness out in the middle of nowhere. Art stimulates the brain by promoting both hemispheres of the brain, that is, the left brain and the right brain. We've been told for a long time now that the left brain is in control of analytics and statistics, hard facts and numbers. The left brain is the nerd that solves all the hard to understand problems. The right brain, however, is the creative, fun, colorful, emotional, and expressive half of the brain. The right brain is very visual oriented, whereas the left brain is very verbal oriented. The right brain sees the whole picture before developing the parts of a picture. While people say that the right brain, left brain theory is not necessarily true, let's look at it from the perspective that it is true. Whenever you're making art, you have a visual in your head as to what you want that piece to look like. which stimulates the right side of your brain. The bright colors, the creativity, it practically screams right brain. But how does the left brain correlate to art, you might be thinking? Well, the hard angles, the shapes, they're part of geometry. That's math. Measuring your canvas to scale your drawing, that promotes the left brain. Even when discussing an art piece, since the left brain is verbally driven, you're exercising that hemisphere of the brain. Creating and discussing art puts use to the two halves of your brain.